he has put as his first priority to encourage and support member states in making their health systems more effective, more affordable, and more resilient. And the new structure, the working methods of the Commission, I think offer a unique opportunity for collaborative work. You all know the way the Commission now works, the system of vice presidents who are looking at specific important areas of work. Commissioner Andriukaitis clearly sees his role as promoting health within the College of Commissioners, with the aim not just of ensuring that health policy in its strictest sense, of course, continues to proceed, but also that the health aspect is fully integrated in all other policy areas. And the area of active and healthy aging, I think, is one excellent example where this is absolutely necessary. In 2014, last year, the Commission issued a paper called Investing in Health, which underlined the importance of investing in health systems, the concept of health as an investment. And when we invest in health systems, we are investing in people's health, and we are also reducing inequalities. We have worked in a collaborative way across a number of Commission services for this conference program. And you will see it covers a wide range of perspectives from a range of portfolios. So we are trying to have as broad a view as possible. But most importantly, the conference will be an occasion to hear from you, to share experiences, and particularly to focus, because this is the important thing, on potential solutions, and particularly by understanding what is being done at the grassroots level. I think this is also something which Europe needs at this time. And the participants here today, I think all of you are will be very keen to learn more about what the EU can offer in terms of financial instruments, how to attract external investments in this area, to learn more about alternative financing and entry to market once EU funding has finished. So that is, I think, an issue of interest to us all. Because fundamentally, you are all partners in the European Innovation Partnership and Healthy Aging. And I'm sure that you all want to scale up solutions, especially local and regional authorities, for example, who are looking at mobilizing structural funds. This is a key question and of great interest. You might also be investors who are interested in contributing to local or regional economic development. So this is also a conference which is intended for you as well. The Commission has recently launched the Aging Report in May, which assesses the impact of aging populations on the EU and on member states. And the long-term projections are very clear. This will pose a very substantial challenge for public finances in the EU. And we know that public health care is a major component of public spending in all member states, and it's increasingly being driven by the demands of an aging society. But that would only be a partial analysis. That's the cost part. The healthcare is an economic sector in itself, an important economic sector in itself, with a strong potential to create growth and jobs, which brings me back to where I started, the focus on growth and jobs. We cannot really be serious about growth and jobs if we don't also look at the sectors that could and should generate this growth. And in this respect, an aging society is also a great opportunity. And Europe is one of the first regions of the world to go through this demographic shift. And I think that offers us also a unique possibility to really be front runners, knowing full well that the rest of the world will gradually go through this change as well. As I said before, the conference is focusing on active and healthy aging and on opportunities for innovative financing. But let's keep this thought firmly in mind that aging is not a problem. It's one of the greatest achievements of modern societies. It's also an opportunity for growth and for the new economy that we need to nurture, certainly in Europe. And this was the whole aim of the European Innovation Partnership on active and healthy aging. Many of you have contributed very actively in this. Also, it was an innovative approach, so more bottom-up than what the Commission usually had done in the past. I know that many of you were very actively committed and have brought to the table a wealth of valuable experience, which has also been analyzed and understood. Now, what are our plans? In 2015, within the partnership, we are focusing on implementing the European Scaling Up strategy on active and healthy aging. Scaling up, we know, is not easy to do. There's a reason why it hasn't happened more often. But it's absolutely essential. Otherwise, experiences as successful as they may have been will remain isolated. And we need to make sure that we don't just remain at the level of best practices, we have to go to standard practices. And that is absolutely crucial. Scaling up is absolutely essential in this regard. And for scaling up to happen, a strategy is essential. We need to identify what are the projects that could be scalable, what kind of timeline is needed for that, and also to provide guidance on how to scale up. It's not something which is often straightforward. So we need to look at success factors. We need to look at mutual learning. We need to look at the tools which could help the scaling up process, such as an online repository of good practices with accompanying analysis, the frameworks to assess viability and transferability of practices. All this, I think, would help the scaling up process by making it easier, or at least to accelerate the scaling up. And during the conference, we will in fact showcase examples of inspiring regional stories, because a lot is happening in Europe's regions. That was one of the, I think, the elements which most positive elements which came out of the partnership, exactly how much work has already been done in Europe's regions. And we will hear some of those inspiring stories, as also including some examples of scaling up from the reference sites in the Innovation Partnership. Some of the good practice examples from the partnership will also support the digital single market, which is, as you know, a strong major policy line of the new Commission, which aims to offer consumers and businesses better access to online goods and services across Europe. And if there is one sector which I think has a lot of untapped potential in this digital economy, it's certainly the health and care sector. I think a lot there, we are just barely scratching the surface of what the technology can offer us in terms of potential. Of course, the idea of innovative financing, which will be discussed in detail today, is extremely important. How to complement EU public money with national programs and with private investments, how to bring it all together. This is obviously a major challenge, but also an area which I think deserves to be the focus of attention and to be the main item for discussion, not just today, but also as a follow-up to this event. In terms of EU funding instruments to support active and healthy aging, DG Santé has supported a number of actions on active and healthy aging through the health program. But other EU funding instruments, such as the research program, Horizon 2020, and also structural funds, can all provide financial support to health investments. The structural funds, now called European Structural and Investment Funds, in the period up to 2020, will invest in health across the board. And within this framework, regions have developed smart specialization strategies that are relevant for pursuing active and healthy aging and strategies for the silver economy. There are many possibilities within operational programs which need to be implemented, and we will hear also something today about smart specialization and operational programs. A health program project has helped build the capacities of member states and regions to deal with the new generation of structural funds. We know that in some areas capacity building was a prerequisite or was essential to make sure that these funds are used to maximum effect. And the Commission has also set up a multi-sectorial and independent expert panel to advise on effective ways of investing in health. And we are always on the lookout for good questions to pose to this panel. And of course, the opinions that the panel issues will be very useful. The panel has, in fact, already issued opinions on how to improve the sustainability of healthcare systems, including an evaluation of public-private partnerships in healthcare delivery across Europe. This opinion was issued last year. And the main conclusion was that there is not enough information to evaluate public-private partnerships as cost-effective compared with traditional forms of public financed and managed provision of healthcare. It's a very worrying conclusion, and I think we need to understand that and what we can do about it. But we will hear about public-private partnerships today, and also about public procurement and joint private co-investments. And this conference is an opportunity to look at these issues in more detail. I turn now to the cornerstone of the new Commission's strategy on delivering real change in Europe and delivering on our jobs and growth agenda. And this is President Juncker's investment plan for Europe. The investment plan is foreseen to be fully operational by September of this year. And the investment plan should help increase investment in key economic sectors, such as healthcare, and will support infrastructure, certainly, but also innovative services. Very often when we talk about investments in healthcare, we tend to think of infrastructure, which of course is essential, but more and more it's about linking the infrastructure, and the service component is becoming an increasingly important area of investment. The delivery of this plan is the new European Fund for Strategic Investments, which promotes private investment by offering a guarantee with the European Investment Bank loans against first losses. And this regulation is currently under negotiation. Public-private partnerships could specifically be supported under this new fund and could bring necessary and effective investments in the health sector. Today at this conference, we will therefore also explore together the possibilities offered by this plan, by European investment and structural funds, alternative financing areas such as impact investing, social impact bonds, and opportunities to develop synergies with funding from private investments with public funding. So quite a lot of ground to be covered, but I am sure that this is an area which deserves, as I said before, a very specific attention. With that, I conclude the opening of this conference, and I have the pleasure now to pass on the floor to John Davis from the European Investment Bank. John Davis, the head of the Life Sciences and Health Division of the Projects Directorate at the European Investment Bank. Since 2011, he is responsible for the team of sector specialists looking at investments in the life sciences and health sectors, and he will tell us more about the work of the European Investment Bank in this area. John, the floor is yours.
Well, good morning, everybody. Firstly, let me say I'm very grateful for the opportunity to speak today on what I consider to be an extremely important topic. Oh, I get to control the universe myself, do I? Excellent. Not least because although I think I'm relatively healthy and active, I know that I'm aging, and therefore I'm going to put my reading glasses on as one of the technological advances that enable me to continue to interact with society despite the fact that my sight's going. Although I can see in the distance, so at the back you're in trouble. Before I share some financing thoughts with you, though, I thought it would be useful just to capture a basic understanding of the problem and to reassure you that although I work for a bank, I do actually have some understanding of the issue. So now we'll see whether left or right. Okay, excellent. Right, so you all know the WHO definition. The important thing point I'd make here is it applies to both individuals and population groups. And I think sometimes the population groups is a thing that we miss out on. So we'll move on. I've tried to keep this as simple as possible, if only for my understanding. So I've split it into three areas. And I want to do this because I think it feeds into the financing needs. The needs of all these three topics are different. So you've got active aging and independent living, which means looking after people as they age, helping to keep them in the community, providing the appropriate support, Zumba classes for the wrinklies, whatever it is. There are a whole raft of issues that need to be addressed in terms of maintaining contact with the outside world. As you age, your world shrinks, and that's basically what that's about. Where the science comes in and the education comes in is in things like prevention and early diagnosis. We're looking here at patient empowerment, we're looking at the ethical considerations, personal health management, all these sorts of issues. I mean, the internet has opened up so many possibilities, and I think this whole area of prevention and early diagnosis is one that requires considerable investment. And the third one is care and cure, where this is, if you like, the classical health interventions, of looking after people in institutions and finding scientific answers to some of the problems. Now, each of these three areas has different financial needs. They all have financial needs, but they're different. Some require capital investment, some require operating expenditure support, and some require building up of the necessary education and training for the human resources that are required. And in each of these areas, there are different entities operating, okay? So, before I talk about the Juncker plan, or the investment plan for Europe, I'd just like to talk about something called INAFIN, which has been around for 8 years now. It's a joint financial tool developed by the Commission and the bank under FP7, and it's a risk-sharing investment tool. So it invests in the science. So it looks at the scientific work being done out there and looks at whether risk-sharing debt is an appropriate way to support it. So it's been going for 8 years. It was completed under FP7 and now as RSFF, for those who are familiar with it, and now it's INAFIN under Horizon 2020. The interesting thing here is there's an advisory function alongside this, so that if you think this is something for you, there's somebody you can call to get some insight into whether you're right or not. And that's something we learned from the FP7 work, that we actually needed to provide a more user-friendly interface with what we were offering. So that's already exists, that's up and running, and supports the sort of RDI activities in the area we're talking about. So, the investment plan for Europe, the Juncker plan. The first thing to say, as Martin said, this is still not tied down and fully defined and agreed. I think the concepts are agreed, some of the principles are agreed, certainly the aims are agreed, as Martin said, but as always with these things, the devil's in the detail. The real challenge here, I think, is on point 2 on the slide. Well, point 1's a challenge because we've actually asked, if you listen, President Juncker, when he presented this to Parliament, gave an incredibly good speech. I think it was about 4 minutes. And he painted, if Google it, it's brilliant. If you want to learn how to give a speech, it's absolutely the model. This is who I am, I have a vision, this is how we want to go about it, but this is what I want from you. And what he wanted from you was point 1, which is the improved investment environment. And that is going to be a challenge. Not least because point 2 requires enhanced cooperation between the EIB, the Commission and the Member States. Now, having lived through RSFF, I know that cooperation between the EIB and the Commission is not always ideal, but we've made a lot of progress. You bring 28 member states into that and it suddenly gets all sorts of complications again. So there are a number of challenges to this, and if the first 2 can be solved, then the third one will happen. Now, to reassure you, I mean, to some extent, this builds on the experience, the successful experience from RSFF and INAFIN, but extends it to the wider issues facing the sector, not just RDI. So, in order to set this up, we collectively, the bank, the Commission, and the Member States, pull together a pipeline of potential projects. There are over 2,000 of these. I know because I've read the list, because my job was to look at the health projects on the list and see what I thought. I have to say there's nowhere near 2,000 health projects on the list, but there are a number of projects on that list which absolutely touch on the issues that we're talking about. Residential care, care in the community, eHealth, telemedicine, those sorts of things feature quite prominently on that list. Now, just because they're on the list doesn't mean to say they're going to get financed, because a lot of this was a wish list from the member states, but nonetheless it's a starting point and we will work with it. So, to get to the summit, what are we talking about in terms of how the Juncker plan fits with what we need? So in terms of eligible sectors, I've put up the list, but if you look at that list quickly, you'll see that in 4 of those 5 bullet points, there are eligible activities that are relevant to what we're talking about. So, urban development and social fields, telecommunications, RDI, investments in education, training, particularly for health. I mean, I think if there's one area, if you talk about growth and employment, if there's one area that we just completely not taking the opportunity, we've got high youth unemployment and we've got huge skill needs in this sector. It's a no-brainer. And we're increasingly, we already are funding education projects. A couple of weeks ago, I was in Vienna looking at a health project which includes increasing their nursing training capacity. These are projects that really need to happen. It's completely ridiculous that we don't do more. So that lists what we call the eligible sectors. In terms of counterparts, I mean, it's basically everybody. Your corporates, from big pharma through national health systems and so on. Here, SMEs, mid-caps. NPBs is national promotional banks. Now, not all countries have national promotional banks. Not all EU countries do. The UK doesn't for a start, but a lot of countries do, and we see that as a route into working together to enable the funds to flow better. So we're already building working relationships with various national promotional banks and commercial banks to help this happen. Now, those two. So the eligibility and the counterparts, that's relatively straightforward. That basically says we can do virtually everything we want. So that's the good news. However, I work for a bank, so we need to introduce a bit of bankability rationale in here. So we still stick to the basic principles. I mean, the EIB is not a charity. It's not a grant giver. It is a very competitive long-term lending institution and is one of the solutions out there. And one of our strengths is that we maintain those standards on everything we do. So the project has to be commercially sound, it has to be economically and technically viable, it has to improve the situation, shall we say. As Martin said, there are also policy issues to bear in mind, and at the moment the issue is growth and employment, so we look more favourably on projects that promote that. 2 years ago it was climate change, and before that it was something else. That we try to follow and support the relevant EU policies. We do use bank intermediation because we want to involve other lenders in what we do, and we want to encourage other financiers to get involved. And then the sting is always in the tail. The pricing is commensurate with the risk. Now, having said that, what the Juncker plan will allow us to do, it will allow us to extend the scope of our activities, and it will allow us to extend the range of risk-taking that we can handle. And that when you look at the different entities active in the sector we're talking about, there's a whole range of risks out there, and what we're hoping to be able to do is to extend, as I say, to do more of and to test the boundaries of what we do. And I think what I'm hoping to get out of today is I think when I looked at the list, there's one other financier in the audience. I'm hoping to get from you what you want, so please come and talk to me and ask me questions. I've kept this relatively brief and simple because I think It's more input for me. I'd like to get from you what you need. So I shall stop at that point and look forward to some interaction. Thank you.
John, that was an excellent overview, and I think a very good way to introduce our work this morning. As I said in my introduction, a lot of interesting things are happening also, not just at member state level, but also in regions across Europe. And the next item on our agenda would be to look at that in particular. So how do regions engage with innovative funding, and how could they engage with the investment plan for Europe? And it gives me great pleasure to hand the floor over to Mr. John Matheson, who is the Director of Health Finance, eHealth and Analytics in the Scottish Government. Mr. Matheson has over 35 years' experience in the public sector, including 25 as Finance Director, both at Health Board level and also for the past 7 years within central government as Director of Health Finance. And he will be, I'm sure, sharing his experience with us, particularly on the link between quality healthcare and financial performance. The floor is yours.
Martin, thank you. Thank you for that. Welcome. It's a pleasure to be here, colleagues. You'll have worked out from the panel members that we've gone up in age from Martin through John to myself. I'm conscious that Martin made the opening comment that ageing is not a problem, it is an opportunity. And that is, I think, the approach that we need to take when we look at this. What I want to do today is I want to just take you through the Scottish experience, give you a little bit of background generally to what's happening in Scotland, the challenges we have, how we're approaching those challenges, and then move on to some of the innovative financing models that we're taking forward in Scotland and how we're going to be approaching the investment plan as we go forward. I've got a number of slides. And I'll run through them quite quickly. The slides will be circulated later. So, the Scotland population of just over 5 million, a significant combination of remote and rural and the urban areas across the central belt, and a significant degree of remoteness. I look after the health budget along with eHealth and analytics. And the budget spend is £12 billion. That's 1/3 of the total spend of the Scottish Government. Local authority is about another third, and then there's education and justice. But of that £12 billion, a crucial factor is the spend on health is only about 700 million of that. The remainder, 11.3 billion, is spent on illness. And one of our challenges we have in Scotland is how we can get the health improvement, the health promotion agenda more prominent. And that has an impact not just within health, but across the wider public sector in Scotland. So the links across into quality housing, which I'll touch on later, the links across into quality of education, into job opportunities are critical factors in that regard. This is the fiscal challenge that we face in Scotland just now. So over that 16-year period from 2009-2010 to 2025-26, the Scottish budget overall will reduce by £39 billion. We're just approaching the nadir of that in the 15-16. So we've got difficult times ahead. But one of the mantras I have is do not waste a good financial crisis. Okay, it's an accountant talking. Do not waste a good financial crisis. Because what we did in the past when we had problems, we threw money at problems. We paid doctors more, we paid GPs more, we paid nurses more. We can't do that now. Pockets are empty. So we need to not use money as the answer, we need to use innovation as the answer. And that's why I'm delighted to be here and contribute to the theme of this conference. We have, as every country in Europe has, the demographic challenges, the 82% increase in the over 75s over the next 25 years. We also within Scotland have an issue around social inequalities, and this is a particular focus of our First Minister. If you follow the grey line on that slide, it takes you down one of the underground lines in Glasgow. And if you go from the northwest, Jordan Hill, down to the southeast at Bridgeton, There are 7 stops on that underground line. And for each of those stops, you will lose, if you're a man, 1.7 years of life expectancy. It's a 5-mile journey in the biggest city in Scotland. And there's that difference of 14 years of life expectancy in that small area. That's unacceptable. But it's a fact in Scotland today. It's driven by obesity, it's driven by lack of exercise, it's driven by drug abuse, alcohol abuse, etc. This presentation does get cheerier as we get into it, so just bear with me. Just bear with me. So what are we doing about it in Scotland? We have a health strategy. We only have one health strategy. We've had it for 4 years now. All our other strategies, our finance strategy, our capital strategy, our eHealth strategy, are all driven by that quality strategy. It's very simple. It's about safe care, it's about person-centred care, it's about cost-effective care. It's about allowing people to be treated, ideally not in a hospital setting, but at home or in a homely setting. We have a triple aim, which we've developed with the Institute of Healthcare Improvement, which is around promoting the health of the population, promoting the quality of care, and promoting best value for money. So money is a factor, but when I talk about financial performance, I talk about quality-driven financial performance, because if you get the quality of care right, then the money has a better chance of going in the right direction. Public sector reform in Scotland, we've got 4 pillars of public sector reform. A decisive shift towards prevention is the first one, prioritising expenditure in public services which prevent negative outcome. We want a greater integration of public services at a local level, better partnership, collaboration, and effective local delivery. We want to invest in the people who deliver our services, enhance workforce development, and we want to improve our performance. Improve our performance not in terms of where the political focus tends to be in terms of inputs, so the number of nurses, the number of beds, the number of doctors. We want to improve our performance in terms of infection rates, in terms of readmission rates, in terms of the quality of care that we provide. When we talk about this agenda, we cannot get away from the political reality. We had a referendum in Scotland last September about whether we would become independent from England. We've been joined up to our friends in England for 300 years, and we decided it was time to just review that situation. The percentages at the top there are the results of the referendum. So 55% in favour of staying with the United Kingdom and 45% against. We have an expression just now in Scotland, which is the never-ending referendum. So though we've had the referendum, it hasn't really gone away, and it's still a live political issue. Elections in the UK elections in May 2015, where the Scottish Nationalist Party were very successful, getting 56 of the 59 seats in Scotland, and we have Scottish elections coming up. The First Minister's priorities are very, very clear, and and that clarity is very welcome. She wants to reduce social inequalities. She wants to boost the economy, which touches on the issues that both Martin and John raised, and she wants to deal with public sector reform. Part of that public sector reform is the integration of health and social care, where we're bringing together some significant budgets to create new organisations with total budgets of £7 billion. I like Einstein because he's got I visualise myself looking like this when I'm 75 with a decent moustache. So I don't understand E equals MC squared, but I do understand that the fact we've done well in Scotland in terms of efficiency. We've taken out just under £2 billion in terms of doing what we do at the moment in a more cost-effective way, and we've reinvested that in healthcare. But we've reached the end of the runway there, and now we need to be more innovative. And part of that innovation is around how we approach the private sector in terms of procurement. We've taken forward the Procurement Reform Act of 2014, and part of that, and a crucial part of that, is that decisions in terms of contract award will not be made solely on the basis of price. So we will look at the engagement with users, we'll look at the innovation within that, we'll look at the quality of the service, accessibility factors such as that. And that has recently been embedded in the Scottish Business Pledge, which was launched by the First Minister a couple of weeks ago. And it talks about a values-led partnership between government and business, a shared ambition to boost productivity, competitiveness, sustainable employment, and workforce engagement and development. We do well at the moment in Scotland in terms of inward investment. Ernst & Young recently produced a survey which showed that after London, we were the largest region in terms of inward investment. In terms of how we promote innovation, we're looking to change our approach and change our relationship with the private sector, with SMEs and with larger companies, and get into a developmental procurement relationship where we will foster innovation. And part of that is the development of the Health Innovation Assessment Portal. And this Innovation Assessment Portal is looking to adopt a more coordinated approach with the private sector. And I will give you some examples of just what that looks like in action, because talking about the theory of it is fine, but it's the reality of it that I think makes the most powerful impact. So we went out to purchase nurses' uniforms. The traditional way would have been price-driven, and the lowest price would have been successful. The approach we've taken now is that price was a factor. I will not hide from that. But a key factor was the shape of the contract and the fact that the supplier, which wasn't the lowest price, was willing to engage in subcontracting some of the work to a firm that supported the disabled employees. And that was the end result of that. The second example, the IV drip line, is a live example from the Health Innovation Assessment Portal, whereby we have identified a company that has potential in this area. And we've said, we will take a risk with you. We will put this into practice in our health boards. And when you then go to look for investment support, you're not able to take it just as a research project, but something that's live and up and running. And hopefully that will enable you to have success in terms of gaining investment support. We have a national procurement organisation in Scotland that is primarily National Health Service based, but is now going to work across the public sector. SMEs is a key area of focus for us. SMEs make up 45% of procurement spend. They are 37% of our GDP. Through the new approach we've taken in terms of procurement, we're finding SMEs are much more successful in winning contracts. What we've done is we have reduced the bureaucracy in our contracts significantly. We're still fully compliant with the European legislation, as an aside, but we have reduced the bureaucracy in our contracts. We've also introduced a framework approach whereby SMEs, rather than bidding and potentially being 1 out of 15 in terms of success, will now be in a much more restricted environment as they bid. So they're bidding 1 against 4 or 1 against 5 with a greater chance of success. And that has been very popular. So SMEs are now winning 80% of our contracts advertised through the portal. And this isn't a result of our target. We didn't say we want them to achieve 80%. We wanted them to be given a fairer chance. So it's a consequence of the Scottish model of business-friendly, socially responsible procurement. So let's move on to some live examples then of innovative finance in action. The first one I want to touch on is the Scottish Wide Area Network. So our broadband capability in Scotland, out with the central belt, out with the cities, was poor, and we acknowledge that. So this is a joined-up government approach that has ensured that the superfast broadband rollout, which was funded by European structural funds, was prioritised in a way that delivered fibre connections across remote and rural areas in the Highlands of Scotland that addressed both health requirements, but also local authority and wider public sector requirements. So that has been a powerful example of the public sector coming together in Scotland. One of the benefits we have in Scotland is, given the size of Scotland, 5 million population, we can do these things, and we can do these things quickly. The second one is the Living It Up project. The greatest determinant of health and well-being in somebody over 75 is how society looks on them. Are they looked on as a liability who's eking out their last 10, 15 years? Or are they looked on as an asset to society who still has something to add back to society and contribute to society? So your attitude as an individual is a key determinant of your health and how society views you. So the Living It Up project is about giving people the opportunity in their 70s, in their 80s, in their 90s to contribute to society. It's funded by a combination of Scottish Government and the Innovate UK. There's £10 million of funding going into it. The themes that come back from our community engagement are fascinating. It's about caring for others. It's about sharing skills and experience. It's about connecting people with their communities. We have 5 local authorities taking part in this. We have a number of health boards taking part in this. But more importantly is the engagement, not just with SMEs such as Sidekick, but with some of the major international players such as Atos, Philips, etc. The Digital Health Institute is one of 8 innovation centres in Scotland. We have invested £120 million in those innovation centres. There are 2 within the health arena. One is dealing with big data, and the second is the DHI. The DHI's aim is to grow with the Scottish economy by £100 million through a different style of engagement with the private sector, and through a partnership engagement with the private sector. So it's looking to improve the cost effectiveness of health and social care in Scotland and stimulate innovation. It's looking to improve the health performance, patient experience. It's looking to improve the quality of life of the citizens of Scotland. And also, and we're quite proud to set this challenge, to build the global reputation of Scotland as a centre of innovation for digital health and care. It's currently engaged with more than 200 companies, and it is a project that excites me personally and one I'm very keen to see move forward and succeed. The structure of it is looking at 3 aspects. First of all, there's the exploratory aspect, so the telescope in terms of looking at research opportunities. And then the experience in terms of the microscope, and it's just about to set up a simulation laboratory within its new premises. And then the factory, the production line, and looking at how we take that forward. A very flexible business model combining top-down and bottom-up. Close partnership with the health service and with local authorities, and also a close partnership with some of the major players, world players, like Samsung, O2, Vodafone, etc. But also a cluster of 120 Scottish companies played into the Digital Health Institute. In terms of what Scotland is currently doing, just a look in the rear-view mirror in terms of projects that we've previously been involved in. I won't go into them in the detail, but perhaps just to highlight the last one there, Next Generation Access. And I pick on that because that is a project of about £300 million. It involves a very close partnership with the British Telecom in terms of driving forward this agenda. And what we are delivering there is world-class, future-proofed, next-generation access broadband infrastructure. What we're doing in partnership with British Telecom, and they're not just a cold partner, they're a partner who are putting their own funding into that as well. And all of these projects have been driven by Scotland, but we've done them in partnership with European regions. I think the richness that comes from that partnership engagement is absolutely crucial. In terms of looking forward, this is what we currently have in our pipeline in terms of 2015, but we now want to look beyond that. We want to look at how we're going to engage in the investment plan for Europe. We believe that Scotland is ready to deliver against the ambitions set out in the investment plan. I believe that Scotland's current experience in the development and delivery of innovative finance models gives us an ideal opportunity to deliver against the ambitions set out in the EIP, not in isolation, but in partnership again with the other European regions. We believe we can deliver the multiplier effect. I've highlighted some examples already in terms of how we've developed a different engagement with the private sector in terms of, for example, broadband and DHI. And perhaps if I could close, I'm conscious, Martin, of time, if I could just close with a couple of further examples. One is around HubCo. So HubCo is looking at how we develop community infrastructure. And we realised that as part of our £39 billion reduction in funding, there is a 30% reduction in our capital fund. So the traditional capital public sector model was not going to work going forward. So we had to find a different model. And this model had to be consistent with our overall health and social care agenda. So we've signalled our intention to improve the efficiency and effectiveness of infrastructure investment. We've now got a £2 billion project over the first 10 years that is well advanced now. It will be taken forward in terms of procurement through a joint venture company which will deliver the project over a 20 to 25 year period. It brings together community planning partners, the private sector, development partners to form a HubCo which facilitates joint working and delivers best value. So in terms of the reality of what that brings about, the 2 or 3 points to highlight on this. The first is that 82% of the contract value is through SMEs. There's a very clear focus on apprenticeships and bringing school leavers into the project, 4,500 jobs created in total, and £1.54 billion spend committed to date, either delivered in construction or in development, rising to £2 billion. And John mentioned some innovative approaches, and I wanted just to close with an example from the housing field. And you might find it strange that somebody with a health background is talking about housing, but the importance of quality housing, particularly affordable quality housing, to the health of individuals, I'm sure will be clear to all colleagues in this room. So in terms of innovative funding models, we have actually won some awards through the use of charitable bonds and ethical investment product, use of pension fund investment coming through as well. We have an asset-based approach generally within the Scottish Government, looking at how we use the resources, how we use the citizens of Scotland in an asset-based approach. So we do recognise that there are barriers. We want to identify those. We want to identify ways of removing them, and a different relationship building up with the private sector. The example at the bottom there in terms of the upgrade of existing housing stock, I think is a powerful one just to close on. So Glasgow Housing Association were upgrading one of their high-rise, one of their tower blocks in the centre of Glasgow. So that was part of our housing initiative. We have a digital technology initiative as well. So they decided as part of that upgrade that they would integrate ubiquitous Wi-Fi into the development. So the tenants now of the newly refurbished tower block pay £5 a month for access to quality broadband, which would normally have cost them £20 a month, and it's integrated within the programme. So the times they are changing. Again, I put Bob Dylan's name up there because when I did this, I got blank looks when I used this slide previously, and younger people in the audience had not heard of Bob Dylan. But thank you very much indeed for your attention.
Thank you very much, John. I think that was also another excellent presentation, which also highlights what is being done in practice. We have a few minutes for a couple of questions to both our speakers before we break for coffee. Yes, the gentleman in the front. Would you just kindly introduce yourself and... There is one, I think at the end, there's one, yeah. There is a microphone at the end of every, always. Yes, no. Okay.
It's always a danger asking the first question.
Yes.
You hear me now?
Perfect.
Okay. My name is Marco D'Angelo, I represent today Health Insight Solution, an SME based in Munich, Germany. I want to ask John Davis, you mentioned a list of 2,000 projects which have been presented to the European Investment Bank. Who did it, the member states or other entities? Because I would be very much interested in understanding how you can include in that list. Thank you.
Yeah, the list was primarily produced by the member states and the Commission in the sense of the structural funds and what had already been identified for the structural funds. I think it's fair to say that there wasn't very much private sector. There weren't very many private sector projects in the list, and that's something we're aware of. And that's why I said, just because you're on the list doesn't mean you get financed. The issue is much broader, and we need to get access to the private sector in this. That's the key. But that list was primarily driven by the public sector.
Thank you. Further questions?
Can I ask a question?
Certainly, go ahead.
So just, John, the bank has funded a number of health PPPs in Scotland and major hospital infrastructure. And you talk about innovative financing, but in fact, my observation would be that you've actually engaged in innovative procurement as much as innovative financing. I don't know whether you'd like to comment on the way that you've actually learned by doing and actually challenged the private sector that you're procuring from to be more efficient and more responsive to your needs.
Thank you, John. Thank you for the question. Thank you for the comment about our approach. We believe we have I think the key is not starting with the money. It's starting with what you're trying to deliver and forget about traditional funding mechanisms and just look at keeping it as innovative as possible. So if you look at HubCo, which is the example I gave at the end there, the procurement model was a blank sheet of paper at the very beginning. And we didn't come to it with this is what we think the answer will be. We had thoughts, but we allowed the conversation to take place with the private sector and very open engagement with the private sector about what they could bring to it. And through various iterations, the joint venture company model came forward. There then was, well, how do you fund within that? And how do you fund in terms of, we need to recognize that the private sector is not a registered charity. They have to make a profit, so they have to make a margin on this. But it's trying to get the risk element. So rather than starting with the funding, we started with the risk profile. And what is the best way of sharing that risk profile? Who is best placed to take that risk across the public and private sector? And from that, the funding model then emerged from that. The final point I would make on that is the funding model is not static. It is still developing. And we need to keep it fresh. As we move on to new projects, we don't just pick up the previous funding model. We have another iteration of that conversation.
Thank you. I see another request for the floor. I think there's a microphone near your seat as well, probably. Yeah. All the seats are equipped with microphones. So.
Audience training program.
Yeah, they're a bit hidden, so that's right. Yeah.
Hello.
Yeah.
It's working. Frida Klotz from the Economist Intelligence Unit, and this is a question for Martin Seychell. I was interested in what you said about Europe being one of the first regions to experience the trend of older populations, and I wondered if you had looked to Japan or other countries other parts of the world that may have experienced something similar or are experiencing the same sort of trends. I understand Japan has done a very good job of navigating this shift.
Yes, indeed. Japan is the closest parallel, not just from the demographic perspective, also in terms of what's happening in the overall economy. And in fact, we are increasingly not only looking at the experience there, but also they are looking at what we are doing here in Europe. I think the big advantage we have in Europe is that we have so many regional possibilities for collaboration, so many regional instruments, and we can act at a number of different levels. And of course, the scale is even bigger. The challenge will be how to take this opportunity and then to use all the opportunities, so all the financing instruments, all the policy instruments that we have, and all the networks for collaboration that we have. And there I think Europe can generate also a very, very strong case and a lot of quality evidence which could really put it at in a very leading position. But of course we are open. So we are also looking at not just the countries and regions that have or are going through this process, and it's not just Japan, there are others as well. because we tend to forget that aging is increasingly a global phenomenon, but also what's going to happen in the near future, where larger regions of the world will also go through this curve. And I think that is going to be a big part of the economy over the next few decades. Certainly it will develop. Yes, please. There must be some magic button somewhere.
Yes, good morning. I'm Nicole Denjoy. I'm the Secretary-General from COSIR, which is representing the leading industry on medical imaging, radiation therapy, and eHealth. We, as you know, Martin, we've been advocating for quite some time how to best use money. Of course, money is not the only answer. All your three presentations were quite good. I was just wondering also, talking about the funding mechanisms. There are many funding mechanisms, different pockets at national level, at European level, through charities, etc. I've been at the World Health Assembly, where also they are looking into how to best use, public and private partnerships. One thing that we see is lacking is all these pockets are not talking together, and there are a lot of initiatives at national levels that could benefit if they were centralized somewhere. So that maybe that model may not work, Scottish model may not work in Spain, or, but how can, is there something at a European level, whether it is a European Investment Bank or the Commission, where there could be a centralization of information? Because we've seen also in the countries, a lot of people in the countries are not aware that they can benefit from structural funds for health. So it's a question basically to all of you. Thank you.
Good question. I think the optimistic spin on this, we're making progress. There are a number of initiatives around looking at this in different ways. And again, as Martin said, one of the great advantages of Europe is we can try different things in different places. I'll give you an example of something I've been working on with DG Sanko. There hasn't been a TB vaccine since BCG about 90 years ago. And the Commission at DG Sanko identified that there was a shortage of research in this area, and we tried to work with them to bring together, first of all, to identify all the potential funders in this space, and there aren't many. I can list them. There's the Gates Foundation, there's the Commission, there's DFID, and there's DGIS in the Netherlands, and that's about it. And then there's the pharmaceutical industry, but the pharmaceutical industry, with one or two exceptions, is not really pursuing research in TB vaccines. Put a plug in for GSK here because they are. But I think the issue is, even in that relatively small ecosystem, it was a huge amount. It took us 3 years to sort of bring everybody together, and people are still coming out of the woodwork to try and join in. So I think it's a real challenge to understand the different funding opportunities that are out there. We've learned a lot. I talked about INNOFIN and RSFF. We've learned a lot about working with the Commission on this risk sharing idea. And under INNOFIN, we're going to try to attract other funders into that group so we can broaden it. But I don't have an easy answer to this, because different people come with money in different ways. I don't know if any of you have ever worked with if you've worked with the Gates Foundation, and I hope there's nobody in here from the Gates Foundation because I might get into trouble, but they can be quite difficult to deal with, and they have their own rules, and with money comes a desire to influence. So I think it's a real challenge, and there is no easy answer, I'm afraid.
Just a couple of comments, Martin. I acknowledge the problem. That's the first thing. But it goes back to some of the points I made in my presentation. I think that is the historic problem. I think I'm coming to the end of my career in the public sector, but for people in the audience, younger people, this is a fantastic opportunity and time to be involved in this arena, because the old rules are not the new rules, because we are getting into different relationships with between the private sector, across the public sector, but also between the public sector and the private sector. We've got a couple of hospitals in Scotland who are looking at this engagement with philanthropists and getting responses they would not have got 10 years ago. And I think going forward, I think we need to not go in with, well, this is a problem, but this is, I'm at John's end of the scale in terms of this is an opportunity to develop a new relationship going forward, driven by the lack of money, driven by the need to take a more innovative approach. The one thing I would say about innovation, though, is innovation brings risk with it and brings the risk of failure. And my experience in life is you can learn more from failure than you can from success. Because success tends to make you complacent. Failure makes you sit back. But one of the sub-challenges there is how your organization responds to failure. Do they put an arm around the shoulder and say, okay, that didn't work, let's move on? Or do they do something different? So the risk appetite within organizations, within my organization, is changing, recognizing the fact that we need to be pushing boundaries. So it was a long answer to your question.
Just very briefly, from the Commission's perspective, a couple of points answering, I think you really put your finger on the issue there. First of all, when we talk about utilization of funding, we have to, one thing we did discover very quickly is that within member states where decisions have to be taken on what to fund, there is a very uneven level of experience and expertise. Typically, for example, ministries of health are not anywhere as experienced in applying and successfully deploying European funds as other branches of government compared to, for example, traditional investment in infrastructure, transport, the environment, and so on. So this is one area where we have worked together with our colleagues in DG Regio and DG Employment and to try and make it easier by producing toolkits, for example. And we are thinking of doing more of this in more specific areas, looking at things like aging, chronic disease, etc., interventions in primary care, try and make sure that we can provide guidance. Of course, then it's for member states to decide what they would like to invest in. That's quite clear. And the other point, also, I think I was very struck by one comment you just made, that you were explaining the procurement experience, and you said don't start with the money. And clearly, I think this is true, particularly true for the health sector, because unfortunately, over the years, health budgets have tended to become big procurement budgets. And we have forgotten what the health systems are there for. They're there primarily to deliver outcomes, to deliver better health status of the population. And that has to be the starting point. And then, of course, the money is necessary means to an end. But that means we have to be much better at measuring outcomes, tracking outcomes, and then changing our approach when it's clear that what we're investing in is not resulting in the outcomes that we are aiming for. And that is also a big part of the innovation which needs to happen. So thank you very much, and I think that was a very good start. Thanks to both speakers. I think you really set the tone for the rest of the discussion. We have a coffee break until 11 o'clock, and I just ask you to be here back on time at 11 so we can resume with the session. Thank you very much.